Hi, I'm Dr. Littlejohn, owner of Portland Pain Solutions. I wanted to share with you a little video capturing a new procedure that we do for a few different indications, and that would be stellate ganglion blockade. We do this for patients with PTSD, anxiety, insomnia, and now for one of the unusual complications of COVID-19, which is parosmia. So the procedure is a stellate ganglion block, which is a little injection of some anesthetic in a little nerve bundle in the neck right around here. We do this under ultrasound guidance, and it only takes about 5 or 10 minutes to do, and is generally very, very well tolerated. This particular case was very, very interesting. My patient, Jillian, we've been treating her for parosmia for the last few weeks. Her initial block was modestly successful. She had some improvement in her usual symptoms. Her second block, though, was absolutely outrageous, and the result was totally unexpected. Within 10 minutes of the procedure, in the recovery area, I mean, she was just elated. She was tolerating drinks and foods that she was previously unable to even touch. It was really heartwarming to see her response to this, and gave us a lot of confidence in moving forward with additional treatments for her. Hi, I'm Dr. Littlejohn of Portland Pain Solutions. One of my newer treatments here has been stellate ganglion blocks for people with PTSD and parosmia, and I have one of my patients here with me. This is Jillian, and we've been doing some blocks for parosmia for her. We saw a little bit of improvement after the first block, but we just did her second block just now, like literally 10 minutes ago, and what's she doing?
Oh, it's so good. It's so good. I already ate this one. I'll finish it up.
You're starving to death.
So this started with Gatorade. She suddenly noticed that she could tolerate Gatorade and it tasted normal to her, and now she's eating strawberries.
And watermelon and cherries.
Does it taste like a cherry?
It tastes like a cherry.
Oh, this is amazing.
You're a miracle worker.
This is really incredible. I've seen some amazing results with this so far, but none so instantaneously. This is really, really cool.
It's also my birthday. It's a big deal.
Did the grape
Karma.
This is the best birthday gift ever. The grape is kind of yucky, but you know what? It's not COVID yucky. It's just, yeah, maybe it's just a bad,
Maybe you just don't like
it was just a bad one. Oh, this is so
Holy
fun.
cow.
This is wonderful.
Incredible.
Come see him. He'll help you. He will. He'll restore your hope.
Well, so just to be perfectly fair and honest, this is a procedure that helps some people, but not everyone. Some people you see a miracle response in, kind of like this. Other people you see incremental progress over a set of blocks. And unfortunately, some people don't see improvement at all. But when you do see the miracle effect, I mean, this is what it looks like. And this is what everyone hopes to achieve.
Wow.
Speechless. I think I have my life back.
I think so too.
Oh my gosh.
Well, when people have the response like this, I mean, it often is sustained. So, I mean, this really could have worked for you.
Thank you so much. Oh, thank you so much.
You're welcome. You're welcome.
I brought the cookies too, so you can even eat a cookie
Yay!
now.
I'm just dumbfounded, I mean,
is
I've had patients with recoveries, but I mean, never right in front of me and in 10 minutes. I mean, that is something else.
Let's try this
So,
again. It smells even better. Oh my gosh.
so this was a left-sided block with about 8 to 10 Cs of bupivacaine, 0.25%, with about 10 milligrams of dexamethasone in there. So,
Time for lunch.
incredible. I encourage it. Now, her benefits were not sustained beyond the weekend, so she really only had about 2 or 3 days of improvement. Now, that was 2 or 3 days of total relief of her symptoms, which was amazing. She's returned today to do another block, which I've decided to do on the same side that she had previously had success with. And if that only leads to temporary results, there are some other procedures that I'm thinking about doing for her, and I may share those with you guys on video in the future. But for now, we have the block procedure on video that Jillian wanted to share with you, so we've recorded that, as well as the aftermath and recovery, so you can see what that was like. Enjoy. So first, just a little bit of basic anatomy. Okay, here we go. All right, so looking around the neck, this is the sternocleidomastoid muscle here. This is the carotid artery, jugular vein, that should be compressible. There we go. And now we're looking for some bony anatomy. So edge of the, probably the C6 transverse process here, it could be C5. So we're gonna scroll down a bit and just double check all of our anatomy. So transverse process of the vertebrae there. So if we keep going south, you can see the flow in the vein and the artery there. And we should be able to find the vertebral, so that's probably the vertebral artery there, definitely something we want to avoid. This is a way of telling that we're at the C7 level. If we're at C6, you really shouldn't see a vertebral artery. Okay, so again, here's the bony C6 prominence, and this is the longest coli muscle, so this is the path that we're going to want the needle to take right into this zone here. So this path here looks like it's going to be optimal. So a little bit more prep on the skin. And I'm just going to put a little anesthetic in the skin to numb it. 1, 2, 3, pinch. Okay, numbing, numbing, numbing. And we're just going to pass that right on through. Here we are. We're in the zone. And we can see that the fascia plane in between the carotid and the longus coli is separating, which is what we want. So I'm injecting about 8 cc's. And still have visualization of the tip. And that's it. So stellate block number 3 completes. All right, so we got a nice stable blood pressure after the stellate block, and we're going to test out some water here. Let's see what the effect has been.
Oh, it's wonderful.
Wow.
It doesn't taste like bleach.
That's amazing. Okay. So far, essentially the same response that we saw with the last block.
And I tried watermelon last time, but the cheese stick was absolutely disgusting. So let's try the cheese stick. Let's go right in for it.
Yep, let's challenge you here.
It smells like a cheese stick. I usually string it, by the way, but... Oh my gosh.
So, Dr. Littlejohn, how about another daughter living at your house for a while and you can just like block her every 5 days?
Exactly. Yeah, you can live in the spare bedroom.
Exactly.
We'll place, we could do actually, we'll place a catheter in there. We'll just tape that to your neck and just dose it,
That's great. That's a
every
great
couple of
plan.
days.
I'm excellent with kids.